Which group is case number one?
Oh, no, there's one. Okay. It's my coffee cup. I broke it.
All right, case number one.
Case number one, if you're ready.
All right.
You're ready.
I'm ready, go.
Are they ready?
Yeah.
Case number one.
Go, Christy.
15-year-old female competitive volleyball player with progressively worsening left knee pain over the past 6 months. Claims that the pain is right below my kneecap. Sports-specific activities such as hitting, jumping, running, and squatting exasperate her symptoms. Whew. Over the past 3
I did
weeks,
not write exasperate.
she has... Is that not that word? That's that word.
Exacerbate.
Exacerbate.
Oh, did I write it wrong? Anyway, go on.
Over the past 3 weeks, she has rested and avoided any pain-provoking activity, only to have the pain return immediately upon resuming volleyball. She claims to have a normal menstrual cycle, but tends to skip her meals in order to not miss any practice sessions.
Okay, based on the patient's report, what do you suspect the diagnosis to be?
Patella tendinosis.
Patella tendinosis. What clues from the patient's report led you to this diagnosis? What clues from the report?
Pain at the patella tendon during repetitive movement and resting relieves the symptoms, but when returning to sport, symptoms return.
Right, so resting in general does not relieve her symptoms, right? Usually resting gets better, not in this case. And when she jumps, lands, that's when it hurts repetitively. Good. What specific sports-related activities are we talking about here?
Landing from jump and squatting.
Jumping, squatting, very good. Name one ankle-related intrinsic factor that can lead to this diagnosis, and please explain why this is relevant.
Limited dorsiflexion, which will not allow the knee to properly extend during heel strike. This will put pressure on the patella tendon.
That's right, so if the dorsiflexion is limited, right, then that will affect terminal knee extension. And if terminal knee extension is affected, that means that the patient's entire extremity is taking heel strike improperly. And that could lead to patellar tendinosis. That is why you don't just treat the patellar tendon, you look at the whole patient. Very good. Name two extrinsic factors that can contribute to this diagnosis.
Poor footwear and
Poor-
poor training.
Right, and what do you mean by poor training?
Premature increase in frequency.
Right, if they run a mile, they go to 10 miles, that's a problem. If their footwear sucks and they don't reevaluate and get new stuff, that's a problem as well. Good. And by the way, I'm going to say this, all goniometry and manual muscle testing, you will have to know how to do, right? It will be on, it's worth how many points? I forgot how many points, but it is, and I don't know, but you have to know how to do goniometry and manual muscle testing properly. Okay, there is at least one person here that passed their last practical because they did goniometry right. Otherwise, they are on the border of failing. You don't want to be that person that fails because you did goniometry wrong, among other things, and not just goniometry. So the easy part, please get right. Manual muscle testing, same thing. Know how to do it. What is weak when performing manual muscle testing?
Quads, glute max, hip, abductors, and hip internal rotators.
Internal rotators for the hip, abductors for the hip, glute max, and quads. Range of motion testing will reveal what? Tightness and inflexibility in what?
Quads, bilateral, affected, there's more pain in the affected or the range of motion. There will be tightness and the affected more than the unaffected, and then we have hamstrings, also bilateral, gastrocs and soleus, and tight lateral structures like the IT band.
Good. Tight IT band, tight gastroc soleus, quad tightness affected and unaffected, but affected worse. And hamstring, same thing, affected and unaffected worse. Good. Active testing. Show us two active movement testing that display the weakness and tightness that you guys discussed. You have the patient do what?
Bilateral squat.
Bilateral squat or
single.
okay, and if it's a bilateral squat and single leg squat, you will see what with the patient like this? Miserable malalignment. And how does that look? Show us.
So hip will be internal rotation.
Hip is internally rotated,
Knee valgus.
valgus stress, and pronation.
Okay.
Right? It's like a complete drop medially because of that weakness. Who has one? Who had? Oh, you one. All right. Very good. Palpation. Show us on a table how you properly palpate the patellar tendon. And like I was saying, the patellar tendon is not a ligament. The patellar tendon really is the quad tendon. It is called the patellar tendon because the patellar is in the middle,
Starting to run low.
right? So the patient is prone.
You
The
go-
patient is prone, supine rather. Yes.
Watch the gummy
I'll never
biz.
get- Yes, the patient is supine and, yes, use that. Use that. Use that.
There's enough.
And about 20 degrees of knee flexion, is the perfect opportunity to palpate. And where is the patellar tendon?
Apex and below.
It's
just
right below the
just
apex
below.
of the patella. It's right there. And when you palpate, the patient will say that, and you're like, great, that's amazing. And I got something right. All right, that's the best position, 20 degrees of knee flexion. Good. Now, special tests to rule in the diagnosis. Some general special tests, because you mentioned that some structures are tight. What's your first special test to confirm tightness?
Eli's test.
Eli's test. How are we doing Eli's test?
The patient is gonna be prone.
The patient is prone.
Sorry, can you guys call us the tripod?
The patient is prone, and when you do knee flexion,
I'm here. Okay.
and if the hip
Flex,
pops,
pops
thank you.
up.
Oh,
If the
wow.
hip pops off the table,
It's a positive sign.
that's a positive sign of hip flexion tightness. Thank you. That's Eli.
That's Eli.
Yes, that's Eli.
One, over test.
The Ober test. The patient is in sideline, the affected leg's on top. The therapist puts the patient in some hip extension and slight knee flexion, and then lowers the leg, allows gravity to lower the leg. If the leg does not touch the table,
It's a positive sign.
that's a sign of IT band and lateral structure tightness. Very good. What's the last special test?
Oh, the Thomas.
Thomas test.
Bring your knee to your chest.
No, sit up, do it right. Sit up. The patient sits up more to the side of the table. Takes one knee, brings it into their chest, and lies back. Lie back. Good. Now,
This is a
if
terrible
the
video.
hip is stuck in flexion, Georgie, what does that tell you?
Hip flexors.
If the hip is stuck in flexion, it's hip flexor tightness.
Hamstring will be tight
If the
too.
knee cannot
Oh no, that's
flex
the
to
quad.
90 degrees, what are you touching it for? If the
Because you-
knee cannot flex to 90 degrees, what does that tell you?
Quad
Quad tightness.
And if it goes out,
If it sails out laterally, that's a sign of IT band. Fine. Now, show me two special tests specific to patellar tendinopathy.
or the passage.
So we would palpate the tendon when the knee is flexed.
Fully
not
extend, you palpate the
extended.
tendon, and the patient complains of
Right.
pain on palpation. It really hurts?
Put it in,
Oh. You put it in the
20.
90 degrees of flexion,
90, okay.
and you palpate again, and then the pain should
Should be-
increase or decrease?
Decrease,
Decrease. So that's a positive sign. Why is that happening?
because it's taut here, so it's protecting.
You sure you're
the
from New York?
Yeah, I'm pretty sure.
All right. All right, yes. If it's taut, doesn't sound right. When the tendon's taut, then if the tendon's taut, it fights back on your pressure, decrease pain. When the tendon's on slack, you push hard, increase pain. Good. Everybody make sense to everybody?
Yes.
Now, what's another way to do this test?
We can do the exact same thing, but in standing, so
Here, just leave it.
Patient standing in single leg stance, full knee extension,
here it's.
palpate. Well, you have hyperextension.
Yes,
Yes, she does.
Then when she
she-
bends her knee,
30 degrees.
Don't judge.
we
Not so bad.
palpate and it's,
Right.
less pain.
Decrease
Yeah,
pain.
so increased pain in full extension, decreased pain at 30 degrees, that's a positive sign. Very good. Any questions on the special tests? All right, now, you want to do patellar tracking as well, but we could let the other group do the patellar tracking. You have to know patellar tracking for this case, but the other group will show us how to do it, okay? Oh wait, which group has the taping? Your group has the taping? Then this group show us the patellar tracking. The other group will show us the taping. This way the other group doesn't do everything. All right, so show us the whole way how the patella track.
So first we're going to find the outline of the patella, so we find the base.
Good. So no. Push on the base, and then you touch the apex. So look, go like this. If I push on the base, you see the apex is popping out. So you push on the base. Now put your little mark on the.
Okay.
Of course, you ask the patient if you could tattoo them up, and then now you push on the apex and you find the base. Got it? Well, not on everybody, all right? Good. And now you push on the medial side, and the lateral side should pop up. And you push on the lateral side, and the medial side should pop up. And for good measure, you could put a dot in the middle or a smiley face, however you're a dot kind of guy. Fine. All right. Now you have the patient sit in what position?
Short sit with
Why do we
pelvis.
Why do we tripod them?
Because it's I don't know why exactly.
Because when they're sitting up, these muscles are
Oh, yeah, right.
firing, which could affect how the patella tracks, right? Because the quad tendon patella. When they're sitting like that, everything's shut off, so you get a really good evaluation. Good. I like to point to the middle, so I'd really follow the tracking, and then we do it actively and passively. So, which one you want to do first? There?
We'll do passively. So
Fair.
you want to.
So I just use, you don't have to do it, but I don't touch the patient, I just look.
Yeah.
And then you actively bring him from flexion into extension, and you look for aggressive patellar movement. Passive tells you what? If there is aggressive movement.
Passive tells you it's weak muscles. Passive tells you it's
Soft tissue.
Soft tissue.
Right, because it's passive, right? Muscles aren't working. So if you see lateral tracking that says, oh, the IT band might be tight because passively it's not tracking well, then you have the patient do it in active. And if you see tracking, that tells you what?
It's weak muscle.
It's weak muscle because maybe the medial side, the vastus medialis, is weak, so therefore it's tracking laterally. So you have to do both. Any questions on that? Excellent, good. So we're saying the patient has lateral tracking, right? Good, so now let's stretch the patient. So first we're gonna stretch the patient, the hamstrings. You guys said hamstrings are tight, but I would love if you stretch the hamstrings without the quads firing. This way you get a good stretch without hurting the patient.
So there's one that you recommended.
I didn't recommend it.
So
Don't hurt yourself, Georgie.
you like
Oh,
and rest your
Oh,
legs
yeah.
against the wall.
Right, so now you see the quads are turned off, and you can even go closer to the wall.
Yeah, somebody can push you a little bit.
No, you can move your butt closer to the wall.
I can.
You cannot. All right. Well, if the patient is wait, don't move. If the patient is more limber, what's your wife's number? We could give us. Send this
Whoa,
to her
why
too.
you asking?
This is what Georgie does all day. Okay, another way. You guys showed me another way. Your recommendation is to use what? I need that.
The leg.
The same thing, lying
Stretch out.
supine and using that.
Straight leg.
Right, you want to not have the quad working. Very good. Patient's relaxed, and the patient is not flexing the quads, it's all passive.
That's
Good.
what I got.
Now,
come on, Georgie.
Wow, he's tight like a tiger. All right.
She's taut like a tiger.
Now we want to stretch the quads and making sure the rectus femoris. How do we do that?
Alright, so using the same belt.
Yeah.
You bring the heel to your glute.
If you want to get the rectus femoris, have them lift it off the table a little bit. There you go. Either something on the other side or just pulls that. That's one way. Good. What's another way you could do it?
Oh no.
Georgie, how ask how old you are? I'm 50.
How old I feel?
You're like a lot of you. All right. What's another way to stretch the quads in that manner?
Oh, you put it right here.
Yeah.
So you just
Yeah.
Oh
There
yeah.
you go. Look at that.
You hear that sound he made
Now
though?
so you give him the phone. You can be on his phone while he's doing it. Good. I like that stretch. Good. The IT band foam roller technique.
We did that last.
You did it last time, but some people, they erase the videos. So show us the right, I would use the bigger foam roller.
Here.
Here's the bigger foam roller. That's yes, fidget toy.
I want it back though. Yeah, we need
Patient
it.
lies sideline on it. Make sure some hands are on the thing. Pick one spot, one leg over the other. Excellent. Good. Okay. Now, dynamic stretching. Now the patient is doing better. So now we can do some dynamic stretching with quad movement. So show me glute and ham stretching dynamically. Oh, whichever one you
The high knee.
want. Good.
Yep.
Whoa, whoa. Keep going. Mas.
You got it right.
Mas.
All right. And then
I missed. I looked down. That's what I got. I was like, wait, do it again. Do it again.
Oh, okay.
all right, and now we're gonna do how would you stretch your quads and hip flexors? Good. Excellent. Excellent. And how long should they actually do it for?
1 to 2 minutes.
Very good. All right, now Therex. Let me see the eccentric protocol. Eccentric protocol is key, especially because the patient said it hurts when they land from squatting or from jumping, right? That is eccentrics. So you have to treat the patient in eccentrics. So Alfredson's eccentric protocol is what? Who's gonna tell us that?
So you find like a board with a 25-degree angle.
Let's assume that's it. Now, what if the patient at home does not have this? And they're not gonna buy nothing? Correct, very good. You take a big book.
The PTA one that you gave.
Ooh.
As long as you don't use it.
Use the plastic still.
Picture this, pretend this is a book, right? Make sense?
The Bible.
Stand like this.
Oh.
Which Bible? Old or New Testament?
I don't know.
Then you're at a you're doing same thing as a decline, right? Right? So that works for a patient who doesn't have it. Anyway, go on. Let's assume they have it. We're in the Upper East Side. Everyone's rich. Is that wrong to say too?
Yes.
I can't say that. I have no offense to Upper East Side people. All right.
Yeah, they'll be fine.
Yeah. So the patient finds a decline, right? They stand on one foot,
1 foot.
and they stand on one foot.
You're gonna come down eccentrically.
60 degrees.
He's
60 degrees.
Yes, and then
Then use your
excellent.
to
Up
bring
up we don't care about. Concentrics we don't care about. 2 legs up, 1 leg down.
Boss.
Good. Slowly. Or could you not do that
It
either?
was.
Look at this guy.
All right. So the patient
Ooh.
That was a burn.
super
He won't be able to
super
walk with it.
slowly, he's gonna do it. He's gonna do it how many times?
Yeah, he will.
3 to 15.
3 sets of 15.
3 times a day.
3 times a day, but on days of heavy lifting, he's not going to do it. The patient then says to you, wow, that hurts about 3 or 4 out of 10. What are you doing to me? What do you say to them?
That's expected.
That's okay. Alfredson likes pain. You doing this for how many weeks, this protocol?
4 and then
4 weeks. How do you progress this exercise?
add weight.
Add a
Yeah,
backpack
backpack.
or an uneven surface, but you could definitely use a backpack because pain is good. Why are we putting the patient at a decline?
It takes away the dorsiflexor.
Right, the patient has tight dorsiflexors. He cannot do a proper squat at 60 degrees because the quads, the gastrocs are going to be pulled. So he cannot do it. If he's at a decline, it puts the foot in plantar flexion, therefore allowing for much more range. Does that make sense? Excellent. Okay, so we got rid of that. Now, open chain exercises on top of these. You said the abductors are weak. What is an open chain off the table hip abduction? Does anybody not know how to do hip abduction on the table? There's a deep doing it. Excellent. If you don't know that by now, then I didn't do my job. All right. What about hamstrings open chain?
Yep.
Yeah, that took me a couple days.
Yeah.
Show us.
Oh, like that.
Ow, ow.
On the table, hamstrings. Okay. With a cuff weight, yes. I was telling the other group, this patient, like all the other patients in this thing, they're coming out from the street. You don't have to do isometric holds. If the patient is in the bed, yes. It's okay to give resistance, proper resistance. You don't need to do gravity eliminated or isometrics. They're ready to. They walk. They use their legs to walk in, right? Carlos, you agree or disagree? And you're walking on the chain. He agrees. All right. Good. Finally, glute max open chain. Show us.
The plank with the, extend your head.
So the patient's in a low plank. That means his elbows are bent. And that's not a plank at all.
Oh,
That is
Jesus.
sleeping.
Georgie's too tired.
So,
How old are your kids, Georgie?
Plank.
6?
so
By 6, you put themselves to bed.
Get your toes on
do
the
it
table.
properly. Put the
Yeah, put
toes
your
on the
feet
table.
on the table.
Do it. Thank you.
And now extend.
Good.
Close to the edge.
And then come down and go up. Good. Now, phase 2. The eccentric protocol in phase 2 is like we discussed. The patient now wears a backpack. Okay? Now,
Mine's heavy.
how would you do hip AB? We don't have to show it because it's the same exact movements, just with a backpack. Now, hip abduction closed chain. Let's see. Oh, they're doing a side plank.
Oh.
That's much harder. Good. All right.
Oh, wow.
How about? Wait, no. Do it again. That's not
Do it again,
closed
do it
chain.
again.
Come up.
The bottom.
That his bottom leg is doing the abduction. Closed chain.
Oh, no.
Now, let's see a hamstring exercise. Closed chain with physio ball.
Exercise.
There's the,
Huh?
you want the regular
Close
circular
chains.
one?
No, this one's better.
Check it out. Look what they've come up with.
I tried to give them.
we're gonna do it on the.
No, we don't want to do it on the table.
Oh, Lord.
Please, no.
Is it the
What it was?
bridge with the
Do
bringing
a
the
bridge.
knee in?
Yeah.
Well, no. What?
Just bring it up,
Yeah.
yeah, just that.
Wow.
One leg. Why 2
If
legs?
you bring the knees in.
Oh,
It's
Lord.
more hamstring.
Where's my
bring the knees
therapist?
in. Yeah. You should do like
Do one leg,
hamstring
yeah.
curls like that with the.
Come on, Georgie.
Yeah.
Yeah, if you go up in a bridge and then bring it in. it's hamstring curls.
But you should have your bottom.
What's up, boy?
All right. Now, let's see. Single leg glute max. Show me 2 exercises.
Single leg.
Single leg glute max. Single leg deadlift.
Behind you.
You don't know how to do a deadlift?
Right behind
I'm learning so much about you, Georgie. Single leg. There you go. A hinge. No, you did it. You're doing it.
Those are RDL.
And you could have a weight in your contrast.
Single leg deadlifts and what else? Can you another good glute max, perhaps? Single leg pistol squat.
Ooh.
Good.
Pistola.
Very good. Deep friction massage to the patella. You put the patient in supine, 20 degrees to expose it. And in which way do you do the deep friction? Medial, lateral.
Perpendicular to the
Yes.
fibers.
Yes. Very
Very
good.
chocolate.
Now, modalities. Your patient requires ultrasound to provide deep heating to the patellar tendon for soft tissue extensibility. How would you set the parameters for soft tissue extensibility? Do you set it for deep or superficial? Which is how many megahertz? Okay. Do you set it for continuous or 100% duty cycle? Sorry, continuous or 20% duty cycle? Continuous. Continuous provides heat, right? Excellent. Very good. 50%. No 50%.
Cut.
That's it. Good job, guys.